This is our first episode in our series all about prolapse. Let's get started. Hi, I'm Jessica Valant, a physical therapist and Pilates teacher, and I want to bring science-based knowledge, empathy, courage, support, love, and hopefully some fun to the journeys we have with our bodies. There is hope and strength in your body, and my goal is to help you find it. Hi, and welcome back to Meet Your Body. I'm so happy to be talking with you today. I am luckily seeing some sunshine out my window today. Fall is definitely trying to make its way to us. I have decided that there should be 4 seasons, but they should be early summer, summer, late summer, fall. And then we go right to early summer again. Those would be my 4 preferred seasons. If we could just keep those, that would be fabulous. So fall is trying to come. Yesterday we had some gray and some cold. And then today the sun is back out. And if you know me at all, you know I'm like a battery. I need that sunshine. So after I talk with you today and record this, I think I'm going to head out for a little walk and a little sunshine. So I hope wherever you are today, you are getting whatever kind of weather you want for your mood and for your day. So today we are talking about prolapse, and this series has been a long time coming. If you've followed me for a while, you know I've talked a lot about prolapse. You possibly found me actually online after researching your own prolapse and your own diagnosis. I know a lot of people come to me that way. So I've told my story quite a bit online over the years, but we haven't quite covered it in the podcast yet. So we're doing a series. We're going to do a 3-episode series. Today we're going to talk about what a prolapse is, what the symptoms are, what you need to know if you are diagnosed with a prolapse. This is going to be the place that you come, kind of that first place. We're going to cover all of that here. Then our next episode, we're going to cover exercise and prolapse because that is a really, really important topic and deserves its entire own podcast episode. So we're going to talk about movement and exercise with the prolapse next. And then our final episode in the series is going to be about prolapse surgery. I am purposefully leaving that as its own episode at the end because many of you listening, most of you listening, will never have to go through prolapse surgery. Most people diagnosed with a prolapse do not need to eventually have surgery. So I always like to throw that out there because I feel like, and we're going to cover this a lot today, there's so much fear and confusion and frustration surrounding a prolapse diagnosis. And that really is why I've talked so much about this in my own story over the years because I don't want anyone to feel those things. I don't want you to feel ashamed. I don't want you to feel alone. And so I know surgery is a major thing that people want to talk about. So we're going to discuss that in detail. But again, we're leaving it for its own episode because many of you listening won't ever even need to address that or know that. And I want to make sure that we're separating it so that you don't jump directly to that place, right? If you've just had a diagnosis yesterday of a grade 2 prolapse, there's no reason for you to even think about surgery yet. So we're going to leave that till the end. But for today, we're going to talk about, again, what a prolapse is, symptoms, treatment, the things I want you to know off the bat. And then we're also going to get into my story a little bit so that you can kind of hear firsthand someone else who's been through it as well. So let's start with the nitty-gritty, the science, the description, the definition. What is pelvic organ prolapse? So most of the time, I will just say prolapse. That's what most of us say. It's actually pelvic organ prolapse because it describes what is happening. Your pelvic organs are prolapsing, all right? And it happens when the pelvic muscles are too weak or stretched or damaged to support those pelvic organs anymore. So your pelvic muscles are almost like a hammock. You can kind of picture them like a hammock. And if you're sitting right now, you're sitting on your pelvic muscles. Okay, so they kind of go between pubic bone back to tailbone and then sit bone to sit bone on either side. That's just a real general explanation for you, but it's like a hammock that's just right down at the base of our pelvis. Those muscles should be springy and they should be able to spring back. right? They have a lot of elasticity to them, and they are there to help hold up our pelvic organs so that those organs don't fall into the vagina. So a pelvic organ prolapse happens when those muscles are damaged in some way. Again, stretched, weakened, damaged, something happens so that they don't have enough elasticity anymore. They're not functioning properly. So an organ, a pelvic organ, is going to prolapse and fall into your vagina. And this can happen in generally one of four ways. There's four major prolapses that can occur. You can have a prolapse of the bladder, also known as a cystocele. That's the anterior wall of your vagina, meaning the front. So kind of between your vagina and your belly button, that's where your bladder sits. So if a bladder prolapses, it's prolapsing. It's called a cystocele. That's a bladder prolapse. Then you can have a rectal prolapse, also known as a rectocele. That's the posterior wall of the vagina. That means between your vagina and your tailbone. Okay, that's in the backside. That can prolapse in. So we've got bladder, we've got rectal. Your uterus itself can prolapse. So it's prolapsing down from the top, and it can actually fall into your vagina. That's the third type. The fourth general type is called a vaginal vault prolapse. So it's when the top of the vagina itself kind of prolapses or collapses in. It's also known as your vaginal vault. So those are the four main types. Your small bowel can also prolapse as well, and that usually comes down from the top too. It's not as common. So in general, those are the four types that we're going to talk about: bladder, rectal prolapse, uterine prolapse, and then the vaginal vault prolapse. Pelvic organ prolapse is most common in women. Now, men actually can have a bladder prolapse and a rectal prolapse. It is just much less common. So in general, women are going to experience prolapse in a much higher incidence than men. It is most common after giving birth and over the age of 60. But again, this isn't everyone. I have talked to so many clients who are shocked that they have a prolapse because they've heard it's only if you've ever given birth, or it's only ever if you've given a birth vaginally, or it's only ever if you're over the age of 75. It can happen to anyone. I have seen unbelievable cases out there in times that people would think, oh my gosh, I never thought this would be a prolapse. And it can happen. So please know it can happen in various times, but for the most part, the most common times is after giving birth, especially if it's a birth with a bigger baby, twins, if you have a vacuum, if you have a long labor, if you're pushing for a long time, those are going to be higher incidence of prolapse after giving birth. And then it also happens very commonly as we age. Our estrogen decreases, which means the elasticity of our tissues decreases. So we're at a higher incidence and a higher chance of having a prolapse. So it's much more common as we age, especially over the age of 60. And I have seen statistics that show that up to 1 in 2, so that's half, up to half of all women may experience a prolapse later in life. So it's something that is extremely common, and it's just not talked about enough. There's kind of this idea around it that it's unknown, that it is embarrassing, that there's shame surrounding prolapse. I know all of those feelings, and all of that causes it to just not be talked about enough. We don't talk about it enough in community. We don't talk about it enough with our friends to understand that it is a common part of aging, that there are things we can do about it. It's not talked about in an empowering way. There's always fear involved, or it's just not brought up at all, which is the way it was for me, actually. Even being a physical therapist and Pilates teacher, I had no idea what a prolapse was until I researched it myself because I was going through it. So when I talk about it, it's really for those reasons that I want to demystify it. I want to bring hope and positivity to a subject that can be scary, that can be shameful. I want us all to feel like we can feel empowered in our bodies. And so by giving you this knowledge today, you are empowering yourself. You're allowing yourself to make decisions for yourself. You're going to learn what questions need to be asked, and you can take back a little bit of control over your body. So I'll give you the background on my own story. And again, I know many of you have heard this before. So I'll give kind of the high level story. And if you want more details, I will have a lot of resources below in the show notes and in the description of this. I'll give you all of my resources so you can go back and listen and see other videos that I have. But for me, I got pregnant and gave birth when I was 35. So 10 years ago, 10 and a half years ago, my pregnancy was normal. I had no problems prior to that. I obviously have endometriosis. I've talked about that, but that has no connection to the prolapse or anything. So that was just a side note at the time. But my pregnancy was completely normal. Everything good. The only thing, interestingly enough, that I did have a history of is something called a LEAP procedure in my 20s. I had some precancerous cells on my cervix removed through something called a LEAP procedure, which caused some scar tissue in that area. And I found out later on that could have led to some of my problems. So completely normal pregnancy. Went into labor, and I was in labor for almost 2 straight days, for 40 hours or so is how long I was in labor. So it was a very, very long labor. She hung out down there for a long time, and my body just would not progress from 9 centimeters to 10. It just would not do that final centimeter for dilation. So I was there for a really long time. Finally got to 10. They said you can push, and I pushed for 4 hours, which is the maximum at that hospital that I was allowed to push. They said, my doctor literally looked at me after 4 hours of pushing, 2 days of labor, and said, you have one more push. I'm going to use a vacuum. You get one more try. And if she does not come out on this push, we're going to do a C-section. And so that's what happened. I pushed one more time with all my might. They used a vacuum, and she came out. Everything fine. Like, I had a couple stitches. I mean, completely normal, fine. So glad that it was over. Brought her home. And about a week after I'd given birth, I was just checking out my stitches down there using a mirror. And my eye, I saw something that put me into shock. And I went to the computer directly, and I Googled, I'm not exaggerating, this is exactly what I put into the Google search bar, pink golf ball hanging out of vagina. And it came back bladder prolapse. And I said, oh my gosh, I think that's what that is. Now, again, I had been a physical therapist for 15 years at that point, almost 15 years, Pilates teacher for almost as long. I had no idea what a prolapse was. No idea. If that tells you anything about how little we know about women's health and how little we are taught about women's health, I knew nothing about this. I also had no idea. I was not told when I left the hospital that being in labor for 2 days, pushing for 4 hours, and having a vacuum are all very, very, very high indicators for having a prolapse. Again, no idea, no clue. Called my OB. Went to see my OB, and he said he just did an exam with me laying on my back and said, yep, think you have a prolapse, think you have a bladder prolapse. You should probably have some pelvic floor physical therapy. We can get you a pessary if you want. Good luck. That was the extent of the information I was given. And so I did see a pelvic floor physical therapist. I also started exercising heavily at 6 weeks, as I was told that I could, because I didn't know any different. I didn't know that I was making myself worse until later on. And so I lived with a prolapse and a bulge. I had a bulge for 7 years, and then had our second baby. And at that point decided I want to just get further information. I don't know if I want surgery. I'm not sure where I want to go with this, but I want some more information. I'm going to see a urogynecologist, and we're going to talk about this later when I talk about treatment. But a urogynecologist is who I should have seen off the bat 7 years earlier. They are the ones that specialize, okay? Listen to me when I say they are the ones that specialize in prolapse. Your OB does not. Urogynecologist. So I saw a urogynecologist finally. Again, it was about 7 years after my first diagnosis. I had had 2 babies at that point, and I was just ready to know what were my next options. What would surgery look like? Did I need it? Would I just live with this like I had been? What was going on? And so he did a full exam and said, well, you do have a bladder prolapse. You also have a rectal prolapse, and you also have a uterine prolapse. They are grade 3 and grade 4. They're not going to go away. They're going to continue to get worse. And you are a surgical candidate if you choose to go that way. And then that is what I ended up doing. So 4 years ago now, I was 40 or 41 at the time, 41 at the time. And I had a full hysterectomy and an anterior repair and a posterior repair and a sacrocolpopexy, all done to repair my prolapses. And again, I'm going to get into details in the surgical episode, but I just wanted to kind of give my full story. And that was 4 years ago that I had that surgery done. So that is my story with prolapse. It has defined a very big chunk of my life. I mean, a fourth at least of my life. A fourth of my life has been defined by prolapse. A fourth of my life has been kind of defined by how I move, how I exercise, how I live with the prolapse. And again, that's why I'm here talking to you, because I feel like we need to talk about it more. I also am here to tell you most of you will not be in the situation that I was in. My situation was very extreme. So we're going to talk about the more common situations, which are grade 1 and grade 2, and what that means exactly. But that gives you a little bit of context as to where my information comes from. A lot of it will be from research, from talking to experts and reading things. And a lot of it is going to be my personal experience as well. So as we walk along this path, I promise I am right there with you. So going back to being diagnosed with a prolapse, as I said, there's those 4 major types of prolapse, right? Bladder, rectum, uterus, vaginal vault. And so that will be part of your diagnosis, is what exactly is prolapsing. The other piece that you are going to want to know is the grade of prolapse. So there's 4 different grades. You can be grade 1, 2, 3, 4. A grade 0 means you don't have a prolapse, okay? So if you do have any kind of prolapse, grade 1 would be the least intense, and grade 4 is going to be the most intense, the most problematic. So many times, especially after giving birth, or again, as we age, as we get through menopause, if we have a history of vaginal births, it is very possible that you would have a grade 1 or a grade 2. And many of the times they're asymptomatic. That means no symptoms whatsoever. I have a feeling that many women in those situations could go and get an exam by an expert and be told they have a grade 1 and they had no idea. All right. So if you're in that category, that's great. Don't worry about it. This is just kind of awareness. It's good to know going forward. The last thing I want, though, is for you to sit there and say, oh my gosh, I had a long labor too. Is it possible that I have one and I don't even know it? I'm here to tell you, you would know it. Okay. I promise, if you have a severe prolapse, you will know. There's just no question about it. But if I also believe on the flip side of that, I believe every single woman could benefit from seeing a pelvic floor physical therapist, especially if you have vaginal births in your past or your history, or especially if you do a lot of manual labor. Like I've seen a lot of occupational therapists, physical therapists who do heavy transfers, who have had some pelvic floor issues. If you do a lot of manual labor or lifting, or if you're just getting through menopause and your hormones are changing, in all of those areas, seeing a pelvic floor physical therapist can be really helpful. You can find out ahead of time, oh yeah, your pelvic floor is showing some signs of weakness. These are some things that we can do. Okay, so again, many people are asymptomatic or may have a grade 1 without knowing it. And in those cases, it's just good to think of this as kind of prevention, right? The same reason we get a mammogram, the same reason we see a dermatologist. It's just that preventative healthcare. So that would be like a grade 1. Grade 2, sometimes that you will start to feel a little bit, and it's more this idea of you might feel something a little bit different inside of your vagina. It might feel a little bit different to sit. You might have a little bit of pressure or pelvic pain. But again, no bulge whatsoever. There's nothing you can see. That would be a grade 1, grade 2. So there's a little bit of a prolapsing in. You're not going to see it. You probably won't feel much with a grade 1. You might feel a little bit with a grade 2. Grade 3 starts to be defined by a bulge outside of the vagina. And there are going to be other things that are used by the doctor when they do the exam to actually give you a grade. But from your perspective, just you hanging out with your body, trying to figure it out, that's going to be the main difference. Once you get to grade 3 and grade 4, the tissues have been so stretched that you actually will start to bulge out. And you will either see it or feel it. So a lot of times your symptoms would be it feels like there's a tampon in all the time. Or you sit down and you feel like you're sitting on a tampon, or even sitting on like a rock sometimes. You're going to end up with more possible back pain, again, pelvic floor pain and pressure. With any of these grades, you may experience urinary incontinence, leaking of urine. If you have a rectal prolapse, you can experience rectal incontinence, fecal incontinence as well. You can experience any of those things, hard to get to the bathroom. You can't get to the bathroom in time. Or you can have the other side of it and have severe constipation. That can happen as well. So those are all symptoms that can start to happen. But again, you're going to be graded 1 to 4. And a grade 3 and a grade 4 are usually defined by starting to see and feel a bulge. Another thing to just keep in mind, a real general thing to know, in the world of physical therapy, we consider grade 1s and grade 2s an area that we can actually reverse. So many times, if you jump on it, if you get treatment quick enough and you do your pelvic floor exercises, if you really work on lifestyle management, you can actually reverse a grade 1 and grade 2. And this happens often. Many times people can reverse a grade 1 or grade 2, especially if it happens after birth. Grade 3 and grade 4 in general are not usually reversible. Now, hear me when I say that doesn't mean you can't live with it. I lived with it for a really long time, and I think I could have lived with it forever, honestly, if surgery wasn't in the cards for me. But I knew it wasn't going to be reversed. I still went to pelvic floor physical therapy. I still did all the things I needed to do to help keep it from getting worse and to move the way I wanted to move. But at that point, the tissues are so stretched. When there is a bulge showing, the tissues are so stretched that generally we can't reverse it. Okay, so it's just something to keep in mind. So I know I've given you a lot of information here. So let's summarize. Symptoms can include pain or pressure, and this is with any of the grades. You could experience pain or pressure in your pelvic floor. A lot of people even think, well, what does that even mean? Honestly, for me, the words that come to mind that I always had going through my head were, I feel like I'm going to bottom out. I feel like the bottom is falling out. Like that is really what I kind of felt like. All of the muscles down there in that pelvic floor were just so weak and tired by the end of the day that's like I couldn't even hold myself up anymore. I just wanted to sit down, or I just wanted to lean over a counter. I always wanted to lean over. I wanted to lean over to brush my teeth. I wanted to always lean over the stroller and rest my arms on the stroller. Like I never wanted to stand upright. It was that kind of pain and pressure. My pelvic floor was just so tired. You can get back pain. You can experience the bulge. Like I said, that's going to happen with grade 3 and grade 4. You can feel like you have a tampon in all the time. You can have discomfort with sex. And again, this isn't for everyone. I have many people ask me about prolapse and sex because I know when you think about it, you think, oh, it's got to be in the way. It wasn't the case for me. I will say I had no problems with intercourse whatsoever during my prolapse. Some people do. Okay, so some people do, but don't think that it's everyone. Each case is individual, but that's definitely a symptom that can happen is discomfort with sex. And then incontinence issues, whether it's leaking or constipation or fecal or urinary. You can have many different pieces of those incontinence symptoms. So those are symptoms you might feel or find. And then when it comes to the grades, you've got grade 1, grade 2, grade 3, and grade 4. And only a doctor, typically a urogynecologist, is going to be able to give you that specific diagnosis. So hopefully now, after listening here for a few minutes, you understand a little more about what a prolapse is, what symptoms you might experience if you have a prolapse, what to look out for in the future, what kind of grades of prolapse you might have. I want you to really kind of have that understanding and that knowledge going forward. So now let's talk about treatment for prolapse. So whether you suspect you may have one, whether you're here just getting information for the future to help kind of either prevent or manage, or whether you already have been diagnosed and you want to know what to do next, here are my tips for treatment. The first thing is to not let yourself get sucked into the fear and the confusion that can happen online. I absolutely know what you will read and what's out there if you search prolapse or living with a prolapse or prolapse treatment. And there's a reason why I name most of my resources living with a prolapse with positivity, positive surgery stories, success stories, simply because I want you to know that there is an option out there. It doesn't mean that we can always heal it. I wasn't able to heal my own, but you know what I was able to do? Find ways to move that made me happy. I was able to exercise. I was able to get pregnant again and have a second baby and have no problems whatsoever. I was able to do all of that with a grade 3 and grade 4 prolapse. And I want those stories to be out there as well because I believe in that for you. I do not believe having a diagnosis of a prolapse is a prison sentence. Do we need to manage it? Absolutely. Do we need to change how we think about movement? Yep, sometimes we do. And that's okay because we can still move forward with hope and with optimism. So that's the absolute first thing that I want you to remember going forward. And having said that, here are your next step-by-step instructions. The first thing is to see a urogynecologist. I actually have two first things. I put them side by side. See a urogynecologist and see a pelvic floor physical therapist. As I mentioned earlier, I did not see a urogynecologist for 7 years. The urogynecologist is who is going to be an expert in this area, okay? OBGYNs are not. They understand the concept, but they are not experts. When I had my exam done, I was laying on my back. I wasn't asked to push. He just looked to see what was going on. That didn't give him all the information. I needed someone who's an expert in prolapse. So when you see a urogynecologist, they're going to be able to measure exactly what grade you are. Like they can measure how far you are prolapsing. They can see exactly which organs. They're going to kind of have you do this in different positions. They're going to talk through various tests that they can do. That is the person who's going to give you the most in-depth information. And again, knowledge is power. So see a urogynecologist. They might also do a bladder voidance test. Mine did. It was a separate visit that I had to schedule. This is if there's any suspicion of a bladder prolapse or bladder issues or incontinence, they can do a bladder voidance test as well, which is really helpful. So please see a urogynecologist to give you accurate information, and don't be afraid to have a second opinion as well. See as many as you need to see to get the information you need and to feel like you have someone helpful on your team. And hand in hand with that, see a pelvic floor physical therapist. You can ask your friends if they know of someone good. You can typically just search online. And many times you don't need to see this person a lot. It's not like typical physical therapy for, let's say, a knee injury where you go 2 times a week for 8 weeks. Many times pelvic floor physical therapists, you can see maybe 3 times off the bat and then just, again, use them as needed in the future. The reason this is so important is they will do an internal exam and they'll be able to tell you exactly which pelvic floor muscles are weak and stretched, which ones might be too tight, and they'll be able to tell if you're doing your pelvic floor exercises correctly. Basically, I don't want you to go home and be doing 500 Kegels a day for a year and find out later that you weren't doing them correctly. A pelvic floor physical therapist can tell you off the bat. My pelvic floor physical therapist was also great at helping me with my hips that were off balance and weak at that point. And she was able to do manual release, and she was able to help me with exercises for home. So highly recommend it. Those are the 2 people you want to see first, urogynecologist and then a pelvic floor physical therapist. Next thing to keep in mind is they might bring up a pessary. So I'm going to touch on this. A pessary is a device. It's not a device. It's an insert, basically. There's a couple different types, but it's typically small and round, and you insert it into your vagina. And the purpose is that it helps to hold up the pelvic floor muscles. Like it It just gives them a little extra help in holding up those organs. It does not heal it whatsoever. Okay, so keep that in mind. It doesn't heal anything. It just helps to hold them up. So there's typically 2 reasons you might want to check out a pessary. One is it is used in clients who are elderly and surgery or other treatment options aren't available, meaning they need something to just make sure that bulge is not getting worse, and the doctor can insert it themselves and will leave it in for up to a month, and then the client goes back to the doctor, has it taken out, has it cleaned, and put back in. Okay, that can be a helpful option in that case where, again, other treatment options aren't available for whatever reason, possibly a sedentary client or someone who is non-mobile. Okay, so that can be an option in that case. It can also be an option if you are simply looking for something to help on days that you need a little more support. That's when it was given to me, and honestly, it wasn't something that helped me very much at all. So keep in mind, it will not heal a prolapse. It's just meant to help kind of, like I said, keep the tissues lifted. So on days when I knew I was going to be really active and didn't have a choice if I was going to be standing the whole day. So for example, travel days, we had a young daughter at the time. I knew I'd have to be carrying her and carrying a backpack and pushing luggage around. And I just had to do it. Like I didn't have time for pelvic rest or anything. I would use the pessary on those days, and they did help the feeling of pressure and pelvic pain on those days. But I will say, when I took it out at the end of the day, all of that came right back. Like it didn't help anything after the fact, but it helped during that time. It didn't really help with exercise for me or anything like that. So you can use it personally, check it out, try it. I just always like to be honest about what a pessary is used for, which is, again, just to kind of help hold the tissues up during that time, but it's not going to help with healing itself. And then a really big piece that I want to touch on when it comes to treatment and learning to live with a prolapse is lifestyle management. And that's the piece that kind of gets left to the wayside, but in all honesty, it's the most important part. So learning how to exercise, yes, super important, but even more so, it's what we call lifestyle management. You need to learn how to live and how to protect your body with a prolapse. One of the biggest being not letting yourself get constipated. That is one of the top things that can cause a prolapse or make a prolapse worse, especially as we age, is being constipated, having to sit on the toilet for a long time, push really hard or really long. So that is a big thing. Don't let yourself get constipated. You have to be able to find a way to stay regular. I know that can be easier said than done, especially if you have a rectal prolapse, but that's a really big one. Another one is things such as giving yourself rest throughout the day. So for me, after giving birth, especially the second time, when I knew I had the prolapse, I knew I could be making it worse. And our baby wanted to be worn and held all the time. Our sweet boy just wanted to be held all the time. So in that way, my management was, okay, I'll hold you for 20 minutes and then I have to sit down and lay down. I'll hold you for 20 and then I have to sit and lay down. I had to let my husband wear him as much as possible because baby wearing was just making my pelvic floor so much more tired. So that was a lifestyle management technique I had to work on. If you love to cook and stand all day in the kitchen, check out your floors. Are they stone? Are they concrete? Make sure you're wearing shoes that are comfortable. Make sure that you're taking breaks and laying down as needed. Those kind of things are really important when it comes to lifestyle management. And then yes, exercise is a big piece. As I said, we're going to jump into that in the next episode because I know it's really important making sure that you know how to exercise and move safely with a prolapse. And one more time, I want to reiterate the fact that there is hope. There is promise. You can be optimistic. You can live a joyful, full life with a prolapse. I am here to shout that from the mountaintops. Yes, there are things that we need to know. And yes, there are ways that we're going to have to monitor our body and manage our movement and make decisions about how we move. And yet, we can continue to move and exercise and live and do all the things that we want to do with a prolapse. I promise. And I hope this episode has given you a little bit of a glimpse into that. I'm going to have a list of all of my resources below. Stay tuned for the next episode. And then also remember, I have a free prolapse workshop coming up in my Unlimited community on September 17th, 2023. So again, that's free for all Unlimited members. And I'll have the link below to sign up for Unlimited and get access to that as well. I will talk to you again soon. Thank you so much for joining me today on Meet Your Body. If you have a moment, please consider rating and reviewing this podcast as it helps us tremendously. For more resources and workouts, you can visit my website, jessicavallantpilates.com, or find me on YouTube or Instagram at Jessica Vallant Pilates.